Neuropathy is a serious complication of diabetes, and early detection is key to managing it effectively. Diabetics can perform simple tests at home to check for signs of nerve damage. Regularly doing these tests can help catch issues early and prevent further complications. Number 1. The temperature sensitivity test. If you're looking to catch early signs of neuropathy before it becomes a serious problem, the temperature sensitivity test is a simple and effective way to monitor your feet. Neuropathy, often caused by high blood sugar, can lead to a loss of the ability to detect temperature changes, which can result in burns or injuries without realizing it. To perform this test, all you need is a cold water bottle and a warm one, or even a warm cloth and a cold pack. Gently apply the items to different areas of your feet, such as the toes, heels, and arches. Make sure the person being tested keeps their eyes closed and have them indicate when they feel the temperature difference. It's best to do this test in the morning when circulation is stable and the feet are clean and dry. Testing 2 to 3 times a week can help you catch early signs of nerve damage. By regularly checking for temperature sensitivity, you can prevent potential injuries and stay proactive in managing your diabetic health. Number 2. Tuning fork test. Tuning fork test is an easy and effective way for diabetics to check for early signs of neuropathy, specifically to assess vibration sensation. Neuropathy, caused by nerve damage due to high blood sugar, can lead to a loss of sensation, particularly in the feet. The tuning fork test measures the ability to feel vibrations, which nerve damage can impair. To perform the test, you'll need a 512 Hz tuning fork, available online or at medical supply stores for about $10 to $20. Strike the tuning fork on a hard surface to activate it, then place the vibrating end on various parts of the feet or ankles, such as the toes, heels, and ankles. If vibration sensation is absent, it may indicate nerve damage. The tuning fork test is a simple, non-invasive way to detect early neuropathy, allowing for timely medical intervention and preventive care. Number 3. 10 grams Semmes-Weinstein monofilament test. The 10 grams Semmes-Weinstein monofilament test, effective way for diabetics to detect early signs of neuropathy, especially in the feet. When high blood sugar damages nerves, it can lead to a loss of sensation, increasing the risk of foot injuries. This test uses a nylon filament that applies 10 grams of pressure to the skin, helping identify areas where sensation is diminished. You can purchase a Semmes-Weinstein monofilament kit online or at medical supply stores for about $10 to $20. To perform the test, press the filament against different areas of your feet, such as the toe pads, arch, and heel, and note if you can't feel the pressure. It's best to do the test in the morning when circulation is stable. Checking 2 to 3 times a week is recommended to catch early signs of nerve damage. This test is invaluable in identifying neuropathy early, preventing complications like foot ulcers, and promoting proactive management. Number 4. Achilles reflex test. A simple test to check for nerve function in diabetics is the Achilles reflex test, which can help identify signs of neuropathy, especially in the legs and feet. Neuropathy, a common complication of diabetes, often impairs the body's reflexes, making it harder for the nerves to transmit signals. To perform this test, you'll need a reflex hammer, which can be easily purchased online or at medical supply stores for about $10 to $15. The test involves tapping the Achilles tendon, located just above the heel, with a hammer. If the foot jerks or flexes slightly, the reflex is normal. If there is little to no movement, it could indicate nerve damage or reduced nerve function. It's best to perform the test in the morning when circulation is more stable. Checking 2 to 3 times a week can help identify changes in reflex response early, allowing for prompt medical intervention and better management of diabetes-related complications. Number 5. Foot inspection. Diabetics often face a hidden danger, the inability to feel injuries or infections due to neuropathy. One of the simplest ways to detect early signs of nerve damage is by doing a regular foot inspection. Neuropathy can prevent you from noticing cuts, blisters, or swelling, which can lead to serious complications if left untreated. To perform the test, you don't need any special equipment, just a mirror, a bright light, and your hands. Sit in a comfortable position and examine the tops, bottoms, and sides of your feet for any signs of redness, cuts, or blisters. Use a mirror to check areas that are harder to reach. It's best to do this daily, ideally in the evening after a bath when your feet are clean and dry. Early detection of wounds allows for quicker treatment, preventing infections or ulcers. Regular inspections can help catch issues before they become severe, offering a proactive approach to managing diabetic foot health. Number 6. Pinprick test. If you're concerned about nerve damage from diabetes, a quick and effective way to assess sensation is the pinprick test. Neuropathy often causes a reduced ability to feel pain or pressure, and the pinprick test can help detect this early. The test is simple and only requires a sterile pin or a disposable needle, both of which can be found easily online or at medical supply stores. Gently prick the skin on various parts of your feet, such as the toes, heels, and soles, and ask the person being tested to identify if they feel any pain. It's best to perform the test in a quiet, comfortable environment, and it's ideal to check 2 to 3 times a week. Testing in the morning, when circulation is stable, gives the most accurate results. If the person can't feel the pinprick in certain areas, it may indicate nerve damage. Regular pinprick testing helps catch sensory loss early, allowing for timely action to prevent further complications like foot ulcers or infections. Number 7. Balance test. Maintaining balance can be a challenge for diabetics due to neuropathy, which affects the nerves responsible for coordination. The balance test is a simple, no-cost way to check for early signs of neuropathy. By assessing your ability to stand on one foot, you can determine if nerve damage is impacting your balance. To perform the test, stand near a sturdy surface like a chair or counter for support, and then lift one foot off the ground. Hold this position for 10 to 30 seconds on each foot, keeping your eyes open and body still. If you're unable to maintain balance or feel unstable, it could be a sign of neuropathy affecting your sensory nerves. It's best to do this test at the same time each day, preferably in the morning when your body is rested. Performing the test 2 to 3 times a week can help catch early signs of nerve damage. Improving balance with exercises like this can help prevent falls and injuries, making it an essential part of diabetes care. Number 8. Monofilament test. The monofilament test sounds high-tech, right? But it's a straightforward and highly effective way to check for diabetic neuropathy, nerve damage, from the comfort of your own home. Here's how it works. The test uses a small nylon monofilament, a thin piece of string, to apply gentle pressure to specific points on your feet. Typically, you test areas like the toes, arch, and heel. When the filament touches your skin, you should feel the pressure. If you don't feel it, that could signal nerve damage in that area, which is common in diabetes. Best time to do the test? Ideally once a day, after your feet have rested and aren't swollen. Incorporating this quick, daily test into your routine can help detect early signs of neuropathy, allowing you to take action before things worsen. Regular at-home tests can be an essential first step in detecting neuropathy early. While these tests can provide valuable insights, it's important for diabetics to consult a healthcare provider for a thorough evaluation and appropriate treatment to prevent further nerve damage. You should also watch this video for ways to prevent diabetes neuropathy. And please subscribe to this channel if you find this video helpful. Thank you for watching.